Hi, I'm Petra Lewis, and this is the final part of Ultrasound 101. And we're going to talk here about artifacts that can actually help us make diagnoses by ultrasound. These are the four artifacts I'm going to talk about here: the Twinkle artifact, shadowing, through transmission, and M-mode artifacts in the lung. Twinkle is a color Doppler artifact caused by calcification, and it's a fabulous way of finding renal stones. You can also see it with a lot of other things, but renal stones tend to be its most common use. So what we have here is a calculus within the distal ureter. We've put color on, and this sort of mixed color comet shape dropping down from the area of the stone is typical for Twinkle artifact. You don't need to know what causes it because there's varying opinions anyway, but put your color on to try and find renal stones using the Twinkle artifact. Shadowing we talked about briefly in the prior section of this video, but basically the ultrasound beam is blocked by the presence of a highly echogenic interface. Usually it's calcium or bone, or it's calculi. Air, as we talked about, dirty shadowing can be caused by bowel. So you may be looking at the gallbladder and you might not see some tiny stones, but you may see a very clean shadow behind them, or in this case, this, which is bowel. This is gas in the duodenum, which has this more dirty shadowing. So this can help us identify things such as the presence of gas or the presence of calcium. Generally speaking, acoustic enhancement is caused by the presence of fluid. So here we have a hepatic cyst, and there's acoustic enhancement behind it. Here is the gallbladder, fluid in, and again, acoustic enhancement behind it. But we can sometimes see this in very homogeneous tissues. So, for example, patients with lymphoma with big, fat, homogeneous lymph nodes can look really remarkably hypoechoic, almost anechoic, with increased through transmission or acoustic enhancement behind them, and it's only when you put the color Doppler on and see that there is clearly flow within them can you distinguish them from cis. I'm just going to briefly mention something that's used when looking for pneumothoraces in the lung using ultrasound with M mode, and this is an artifact that's produced by pneumothorax. So if you put M mode normally on the lung, you produce what they call a seashore type pattern. So you see the sand, and then you've got the waves going on here. When you have a pneumothorax, the pattern changes because you have air which is preventing a normal transmission of that ultrasound beam, but in a different way. And it then turns into what's called the barcode type pattern. So seashore is normal, barcode is the presence of a pneumothorax. And that's all I have to say in this brief Ultrasound 101 series.